Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of Geriatrician Dr. Andy Mencia. Okay, so we're going to talk this morning about that wonderful sun, not the S-O-N, but the S-U-N.
My God, this summer is crazy. It's a hot summer. Hot stuff, sizzling hot. I not like sizzling.
Well, it's an interesting thing when we talk about the sun, because I was saying to Dr. Mencia that I lived in Miami for many, many years. We did not have air conditioning. We had jalousie windows. We had fans. And we went outside, and when the kids were hot, we took a hose, and we had a sprinkler, and they ran in the water.
Yeah.
Things have changed now.
It have changed a lot with the change in the environment. We don't have the protection we used to have then. With the growth of civilization, we have more cement and less green around us. As a matter of fact, some of the community, when you're going to build a new, let's say you're going to tear down an old building and build something new, they will require that you have X amount of land devoted to green. And some community don't even ask for that. So when I built the AGI center, the first center, over 15 years ago, in the design, I told the architect, I want green right alongside the building. If you notice, my building is surrounded by green.
Yes,
it is. Surrounded by green. So we keep close to Mother Nature, and we are not provoking what the development of society is provoking on us, like heat stroke. A lot of people now in this summer, today the temperature is going to be in the 90s, 92, 93, right? Ina?
92.
92 in Russia.
How do you say that in Russian?
Yeah.
92.
Divino Sava.
They're just two little numbers that take that much to say?
Divino Sava Fahrenheit. Da? Хорошо?
Очень хорошо.
Очень
Oh, you're
хорошо.
teaching him Russian.
Yeah.
Oh, my gosh.
That's why
okay.
I hire her.
That's right. You have a Russian instructor.
Yeah.
Okay, so getting back to
Free of charge.
sunstroke.
Free of charge.
Yeah, free of charge.
So if you don't teach me, I won't sign that check.
That's
okay,
right.
okay.
I'll do it. Okay, so tell me about how do I know that how do I know that I shouldn't be outside and I have to be outside? What am I supposed to be doing?
Well, a lot of people get confused, and some people, let's say, they are inside the house, but they go in the attic. And if the temperature outside is 90 degrees, in the attic in your house, because there's absolutely no circulation going on there. So the attic can be 120 degrees.
Huh.
So a person go in the attic and they start looking for something, or they start doing some work and they are not drinking water. The core temperature, not only the outside temperature, but the body core temperature will start rising. Now, if you can imagine the body as a cake, you have the inside part of the cake and the frosting outside. The skin is that frosting. So whenever you change from a cold area to a warm area, the frosting, the skin is the first one to let you know that you have changed temperature from cold to warm. So you start sweating. Now you go into the attic, you have changed temperature from 90 degrees, or let's say inside the house is even worse. You could be 70 degrees inside your house. You go into the attic, 120. So the first thing is your skin will start sweating. That's the outside temperature. Then it keep increasing the temperature until the core temperature start rising now. Now your core temperature can rise, and when heat stroke is when that temperature goes to 105. That's extremely high. And when that temperature rises to 105 in the core temperature, guess what happened to the frosting in the cake?
Melts.
It melts. It just cannot produce any more sweat. So you stop sweating. And that's one of the first signs you're going to have. You're going to say, I'm not sweating anymore. You better get out of there.
Oh.
Once you stop sweating, now you're going to dehydration. You're going to a mode of dehydration. And then you start combining hot temperature, cold temperature with dehydration. That's the perfect storm coming in. And you will get heat stroke.
Wow, that was a very good description.
That
As
you'll get heat
usual,
stroke.
All
And
right,
the person,
now,
the interesting thing, if you get heat stroke, you can get confused. So let's say you're working in the attic, you're working with some electrical stuff, or you're working with some, you can get electrocuted because you will be confused. If you are in the beach and you go and you don't go in the water, you don't bring water with you, when you start getting a suntan, you go in the beach to get a suntan, you just lie down in the beach and
Fall asleep.
fall asleep. And first you're going to start sweating outside again. Then the core temperature start rising. And as the core temperature rises, you stop sweating. Then you start getting confused. And then you go, you know what? I'm just going to go home. I'm so tired. I feel nauseated. Maybe I ate the wrong food.
the nauseous.
So now you get in the car. And those are the people that will drive into a lake because they are confused now. They will kill other people in the car. They will kill themselves. They will go off the bridge because they are driving confused. And people that are stubborn and keep going, they even can get a seizure, go into an epileptic attack, or they can go into a coma. And
Okay, well, what would, let's say I'm with someone and they feel these things. They say, oh, I don't feel well. What do I want to do? I know get them out of the sun, but what would I want to do to help them right away? Get ice and put ice all over them?
you can put ice all over, get them some water to drink if they can still drink, if they are not, going into a coma. As long as they are able to respond and you say, how many fingers in front of you? 2 fingers. Can you sit up? And they sit up. They can follow command.
But get them cool somehow, huh?
The first thing you want to pull the body away from the heat into a cool area. If there is an air-conditioned area, there's a restaurant nearby. Bring that person inside the restaurant as you wait for the emergency support system to come in to take him to the hospital. At the hospital, sometimes they have a bathtub full of ice waiting for that person. And they will put him or her in a ice bucket, let's say.
You're making this sound very serious.
It is very serious. A lot of people die from heat stroke. The brain cannot tolerate heat. The central nervous system, that's why people get confused. That's why confusion after, nauseated, and then you get confused. And the nausea comes because the nerves, the central nervous system, is malfunctioning now. Because once you get into heat stroke, the thermostat inside your body shut down. So, when we are in normal function, we have a thermostat that let us know that is, let's say, the temperature inside the studio is too cold, we put a jacket on. And if it's too hot, we take the jacket off because, we respond to the thermostat. The thermostat will let us know what to do with our body. So once the person thermostat shut down, the temperature by definition rises to 105 or higher degree Fahrenheit. Then the thermostat at that moment shut down. It's non-existent. So you have to control that thermostat. So what would you do if it's hot? You want to take your clothes off. So the first aid that we do in a person having a heat stroke that is getting confused and nauseated and they're having palpitation, rapid heartbeat, take off the unnecessary clothes. If it's a beautiful girl, I'll take off everything. But take off all the...
but you're saying, does it really make it, once you're in a heat stroke, do the clothes really make a difference?
Of course, because you want to remember, you're going to take that person now into an air conditioning area to bring the temperature down. So you take off all the clothes, the unnecessary clothes from that person, bring the person into an air conditioning area, give some water if the person can drink. If you have, sometime in the restaurant they has the ice in
Right, I was
ice
going to say,
pack.
right, put his
You just put it by the axilla.
Oh, underneath
put it,
their arms?
Underneath their arm, because you're getting close to the core temperature that way. So you put ice underneath the arm there, between the leg, anything that will get close to the core temperature, and taking the clothes off, and doing this to the person. Then you start
Do
cooling
you lie
down.
them down?
You bring
Do you want them to lie down too?
to lie down, of course. Yeah.
Okay, well, I guess what I was thinking when you were saying this with the heat, how does somebody know that? Well, let me give you an example, because
That
we're
they are
saying
at
in the
risk.
sun. Well,
First,
it's
how
in
do
the
we
sun.
know we are at risk?
Yeah, but
Because
wait.
any of us can develop. There's no age limit. Any
It's
from
just
the
harder on
baby,
an older adult, though, isn't it?
it is much harder, and they are more prone to die from heat stroke than a younger person.
Than a baby.
And a baby is more prone to die. The younger and the older are more prone to die than
Why?
Because the body is more vulnerable. Yeah, the baby is still developing. So if, let's say, you leave a kid in, a newborn in a car,
Oh, please.
and you shut down the car, it takes only about 5 minutes for the
Oh,
temperature to
boy.
rise 20 degree.
Oh, my
20
heavens.
degree. So let's say you leave a baby in the car, you go shopping, you do whatever, it took you 10 minutes. The temperature also has risen 15 degrees inside the car. So it doesn't take much. Baby is not going to grab a bottle of water and start drinking. They're just going to sit there. They're going to sweat a little bit, and very rapidly they will go into a coma and die.
But wait, but you just brought me to attention. A lot of people have their spouse waiting in a car while they go in, and hopefully they keep the motor running with the air conditioning on.
Right.
But some people don't have air conditioning, and some people want to save the money, and so they're sitting in this hot car
In a hot car with a baby and
without the baby, even by themselves.
by
An
themselves,
older
and they
adult
can
that does
absolutely.
that. And dogs. You know,
And
how many
dogs
dogs
also.
are being killed?
Dogs go into heat stroke just like human. As long as that temperature rises, they will go into a heat stroke. The difference also is like who is at risk is if you're taking a water pill, that's going to dehydrate you. So if you're taking a water pill and you sit in a car without air conditioning, that will put you at risk of a heat stroke. If you're taking a water pill and you're drinking alcohol and you get exposed to heat, that will, that regardless of your age, you can be 30 or you can be 90 or you can be 3 months old, that's a bad combination. So dehydration is a bad combination at any age, and alcohol is a bad combination.
All right, let me tell you
in
something
young
that
adults.
happened to us recently. Our air conditioning went off, and the air conditioning started to rise, and it went to 8. I mean, there wasn't air conditioning wasn't on, so the heat in the apartment was 85, and it really got hot. And so we tried to get the air conditioning people to come right away, and they couldn't come for 3 or 4 hours. And I said to Bill, we probably shouldn't be here. We probably should go to a restaurant, go do something else.
Right, exactly.
But we were waiting for the air conditioning people because I hadn't realized, even without being in the sun, the heat in a house could do it.
Right. If you live in a condominium, an apartment setting, something like that, and you lose your air conditioning, the right thing to do, is to ajar the windows so you get some ventilation coming in.
Even
And
though it's
then-
hot, it's still okay?
Wait, and then close your apartment, go down to the lobby,
Oh,
and sit there and wait. Don't stay in your apartment waiting for the people to come. Just let them know.
that's good advice.
I will be at the lobby. When you come in, look for me. Don't sit in your apartment. I don't care if it's 11 o'clock at night. Go down to the lobby. You wait there until those people come. And
That's good advice because I was concerned about that,
Yes.
that it got too hot. So heat stroke isn't something. Do you get people that come into your practice, and you could tell that they have been overheated?
that they are at high risk because they come, sudden palpitation. They come to me and they say, doctor, I'm getting this palpitation. I don't know if I ate the wrong food because, I feel nauseated. And I ask them, well, what have you been doing? And they say, working in the backyard, I was drinking a few beers, So I don't know if it's the beer doing it to me or so it's the combination of things. So you normally just have them sit and drink some water, and sitting in their office, it's a cold temperature, and some of them would get in a car and would not use the air conditioning.
That's true. They're trying
So
to
they
save.
are working in their backyard. They are drinking alcohol. They are not drinking water. They feel the first symptoms. They get in the car. They are not confused yet, but they get in the car and they come in and you wonder, are they taking drug or not? They look confused. They look drowsy.
Mm-hmm.
And when you ask them what they've been doing, they say, okay, this poor person is just prone to a heat stroke. So we start hydrating them. And, hydration doesn't necessarily mean intravenous. The best type of hydration is when you are able to drink.
Really? Just
That's the
through
best.
the mouth.
Through the mouth. It will
Cold
never,
water or regular
any
water?
water. I like room temperature, but any water, cold water, room temperature water. Drinking fluid, as you go. So let's take today, the temperature is supposed to be in the mid 90 or low 90s. Even if it's in the 70 or 80, when you wake up in the morning and you're going to exercise, start drinking fluid. And I always go to sleep with a bottle of water or a glass of water. And if I sleep throughout the night and I didn't touch the water before I get out of bed, I dangle my feet and I drink the whole bottle of water or glass of water before I get up.
And why is that?
To hydrate myself, because then I can do my meditation, my exercises, go through my routine, do everything I have to do, but I start hydrated. I don't start dehydrated, because you never want to catch up with hydration. You want to stay ahead of hydration. So
But
you
don't
want
you
to be
have to
hydrated.
then urinate a lot if you do that?
That's a myth. That's a big myth, and that's a great point you bring. A lot of people, especially if they have urinary frequency because they have an hyperactive bladder, or if they take medication, some of the medication now for diabetes make you urinate a lot, and some of the diuretic, of course, make you urinate a lot. So if you have any of those conditions, you're going to urinate, but you have to keep your body hydrated. So your body was, this body that God made for us is such a unique universe that we have. And when you drink the water, the first thing the body is going to do is, am I being overhydrated or am I underhydrated? If you are underhydrated, it's going to utilize that water. It's going to go into your cells, and it's going to go into your circulation, and it's going to go into the brain. We need water. More than 70% of the composition of our body is H2O, is water. So we need water for the body to function. You look at two individuals, one that have kept him or herself well hydrated, and the other one that keep him or herself mostly dehydrated. The dehydrated person, same, everything else being the same, will have a lot more wrinkle, the dehydrated person, than the hydrated person, because the skin is composed of cells. Your hair is composed of cells. So as those cells get dehydrated, you lose collagen, and the loss of collagen promotes wrinkle.
Okay, you've convinced me.
So
I'm going to have a lot more water.
Yes.
And I'm going to go to the bathroom a lot more, but I don't care, right?
We don't care about that.
Okay, I'm going to do. No, but I was thinking recently. We heard in Arizona the temperatures were up to 112 and even 120.
120.
Well, people can't even go out
Now
then,
in
right?
Arizona, 120 back up. If you go into the attic, you're talking 140. 140. So if you go into the attic, you spend 3 or 4 minutes there without being hydrated, you can go into heat stroke.
Get rid of
You
attics.
have- yeah.
Cellars. We want more cellars,
More
right?
sellers, yeah.
Well, Dr. Mencia, of course, is our star every Saturday morning. He invented the wonderful world of wellness. And if you've been listening for, 7, 8 years, however many years it has been, You have learned so much. You have really gotten an education to be a doctor yourself, frankly. I've learned so much from Dr. Mencia, as I
Apply
know.
at AGI for your degree.
That's right. Apply at AGI. We're going to get a medical degree from AGI. That's not a bad idea. You know what? We're going to work on that.
We'll work on
AGI,
that.
Medical and Dental Centers. He started in Fort Lauderdale, and now he's also in Boynton Beach. And the phone number is 954-489-1345. 954-489-1345. They're located on East Commercial Boulevard. They have a beautiful office building that the nice thing is they have highly trained specialists. They all work together to provide optimal cutting-edge patient care. And, of course, Dr. Mencia is the orchestra leader. He's the conductor. They have a beautiful office, new in Boynton Beach. And if you're closer to that, are they open on Saturdays also?
Boynton is not open today.
Not open
No,
today, but
but
normally they are open.
Normally
but,
open on Saturday
But if
also.
you need a doctor, you're feeling a little bit like heat stroke, please go down to Dr. Mencia, and he will help you. And the nice thing is, if you're really in critical condition, you don't need an appointment. That's the wonderful thing about them. You should make an appointment. It makes it easier for everyone. But if all of a sudden something happens, don't go to the hospital. Go to Dr. Mencia's office on Saturday. You close what, at 1 o'clock, 2 o'clock, 12?
Depend around 12 o'clock.
Especially
We start
now in the
wrapping
summer,
it up. Yeah,
so
we
hot.
start wrapping it up at
Okay,
12 o'clock.
home visit services are available. This is the most important message we can give you. If you're a homebound patient, you don't have to be alone. You don't have to be there and not go to your doctor. Please do call them. Phone number again, 954-489-1345. And the website is agifl.com. And Ina, I want to ask you a question because you're very involved with a homebound situation. How is that working?
It's working wonderfully.
Tell me why. Tell me what happens.
Patients love it because a homebound patient, they cannot make it to the office and they need a prescription, let's say, for the high blood pressure. And they have no family members around, or they work or what have you. Then that's a great opportunity for us to go to the patient's home and deliver what they need.
Or sometimes they might have a little infection in the urine and they don't
or
want
the
it.
patient might fall and have a wound, and our doctor can go and do evaluation, and then we can send the home health nurse to do the wound care for the patient.
You know, I always keep talking about this because I loved my mother so much, and I'm probably more educated in a lot of the things to do with an older adult, but yet I didn't know what I was doing with my mother, and no doctor would go there. And, of course, at the time, I did not know Dr. Mencia, and I had to literally beg and pay a lot of money to have a doctor come just to visit my mother, and turned out that they then had to put her in hospice. She was literally dying there in bed, and I didn't know that, Ina.
You
And
know,
that's it's horrible.
Yeah, I had one of my patients this week that she works and she worked for one of the banks in here in Boca Raton, and she goes to Fort Lauderdale to see me all the time. And she said, "Dr. Mencia, you're doing so well with my diabetes and everything. I love the fact that you practice preventive medicine. That's why I travel here for you." And she goes, "But I have this dilemma because my mother, I have to relocate her from Connecticut. And she's going to be living with me, but I cannot lose my job. So I'm thinking, should I just degrade my position so I have more freedom to take care of my mother? She has advanced Parkinson's disease, and how am I going to take her to the doctor? I would love for her to see you." So I say, "Well, do you look at Boomer Time, the magazine? We advertise there, and we say there all the time. We said on the radio that we do home visit." And she said, "I didn't know that." I said, "Yeah, it's all over. Look at the advertisement we have here in the office. We do home visit. My staff will come to the house. They will see your mother. And every 6 months, if you want to, when you have time off, then you bring her to the office if need be. But the services, you're going to be so happy with the services that most likely you're going to be just okay with mom staying home and we providing care for her."
Multiply that millions.
Exactly.
And I just thought maybe that's
Absolutely.
the next article in August. Let's talk about home care and what you do and what the advantages of having a doctor come to home. People
There's a
don't know
lot.
that.
There's a lot of homebound patients that, unfortunately, they are basically, it's so difficult to take them to a doctor office. But the loved one, you do it because you love that person.
And I
So
love
bring
you,
them.
and we have to say goodbye because you have to rush off, and we're running out of
so
time.
much.
And
Don't pull me away, Richard.
yeah, I know. Well, anyway, please do call for an appointment, 954-489-1345. And I think we should do a whole article next month on the advantages of having home a doctor going to the house like you do. I can think of a lot
A
of things.
geriatrician. Read the article on geriatrician on this issue.
That's right. The great article between a medical doctor and a geriatrician, which you are. Thank you both for coming, and we'll
Thank
see
you,
you
Anita.
soon.
Thank
Goodbye.
you.
Thank you.
Have a good one.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.